When you're in a hospital environment, it just feels fairly normal because in the hospital anything goes. People have got things hanging out of all kinds of places. But when you first come out of the hospital, it's the realisation that you've got this thing coming out of your nose and people are looking at you, and you kind of have to make the decision. Either you walk around with your head down and try and hide it, or you just hold your head high, and if people want to look at you and stare at you, that's their problem. I went around with a tube down my nose for about 9 months, which is quite a long time.
Yes.
But they kept on coming out and tying themselves up in knots.
Yeah.
And then I would have to wait to get a replacement, which was quite hard.
Yeah, so the research that I was doing was trying to ask people what experiences they'd had of their tubes in the community and what sort of support they wanted from us as healthcare professionals, and what they really felt they wanted healthcare professionals to know about the tubes, and other student practitioners to know about the tubes and how best to support people with the feeding tubes.
It kind of superficially it felt like I had support because I had a 24-hour phone number I could ring. But I soon found that every time I rang the 24-hour phone number, I would just be told the same thing every single time: go to A&E.
So what were those first few months like when you had the tube put in and had to go home and manage it by yourself at home?
It was the realisation at first that I had all this stuff and I had to find somewhere to keep it. Because it's not just a tube. You need boxes and boxes of feed and sterile water and syringes, medication to go down the tube, just so much stuff, and you just think, where on earth am I going to keep all this stuff?
Tube feeding takes place in the community, and it's a very different scenario to being in hospital with a tube and being out in the community. So there's all the practical issues, day-to-day life needs to go on, people want to do hobbies, they want to get back to work. So there's a huge gambit of different things that patients need to tackle, as well as their medical conditions, and we try to help with that. And also not just the practical aspect, but very much about policy and service provision.
We've worked together for a long time, and PINNT is a core group of BAPEN, and we have always been clear that one of the great strengths of BAPEN is bringing together the multi-professional groups, which includes yourselves and the patient voice, medical staff, nursing, dietitians and pharmacists. So it's that strength of working together with that multi-professional organisation that brings our strength to support patients in nutritional care.
I think our relationship in terms of the professional side of this is extremely important, because it's a rather unique relationship where patients aren't just talked about, they're actually part of the planning and the process, and we're helping to shape future care and services within that united forum.
Yeah.
I was trained in the hospital by the company that supply the feed, but it was literally half an hour.
And I suppose it's different when you learn in a hospital environment, coming home and trying to manage it at home when there's no one around.
And all kinds of things happen and you don't know what to do when you vomit a tube up, or it looks as if you've got an infection around the tube site, or it doesn't feel as if it's in the right place. I can't remember the last time I asked a medical professional for advice, really. I've become my own expert. I know my body and my tube. The only thing I ever need to contact anyone with is if my tube's broken. And that can be hard sometimes, because the layman would just think, oh, your tube's broken, give you a new one, but you often have to wait, which can be hard, especially when you're hungry. And I think that sometimes people don't appreciate quite how hard that is.
Yes. So many of the people that I spoke to during the research study that I did said that they didn't want to go into hospital and would avoid it if they could.
Mm-hmm. My experiences are that you go to A&E and you suddenly end up in hospital for weeks and weeks on end, and it gets to the point where you think, what am I doing here? Nobody seems to know why you're there still even. You seem to spend so much time in hospital that you just really want to do anything you can to stay at home.
And so I think our collective experience and our learning from a healthcare professional's perspective is starting to understand what the gaps in care are, what the true needs are for patients receiving tube feeding, and understanding, I suppose, what good looks like. And I don't think that across the NHS we have a clear understanding of what good looks like, what a good service looks like from both a service delivery perspective, but also really importantly what patients need and want from their service.
Absolutely. I think what we've also got to bear in mind is the education that we're teaching patients to self-care, to represent themselves, and some of those education pieces for the patients and carers are very hard when you're then up against healthcare professionals in day-to-day communities who really don't understand tube feeding. So that's something we need to work on to educate healthcare professionals. I think first and foremost to start listening to patients and starting that dialogue, because actually it can help with the treatment and the options that they need to carry out, because we hear so much from patients. They arrive at A&E with a problem with the tube and they're met with people that have no knowledge about where they go, what they're used for, and why it's so important to get the problem sorted, because effectively they're going to starve or dehydrate if they don't get their feed.
So do you think there's a voice for patients in the healthcare system?
Absolutely. It's there, but maybe we need to step it up a little bit, and we need to do it in the right way. We don't want to critique what's going on. We want to constructively say to healthcare professionals and the system, we are here, this is what we have to deal with, how can we work with you to improve it?
Okay, and I'd very much hope that BAPEN and our two organisations obviously have worked together for many years, but beyond our organisations work with other stakeholders in the healthcare systems to make sure that we support patients and their families to receive the best care that they can.
I mean, in the last, I think, year to 18 months, there has been a local enteral feeding service that's been set up, and I think I would have found them useful when I first had the feeding tube, because they will actually come to your home, look at your tube, and talk about what's worrying you. And it's quite shocking to me when you go to A&E and they don't know anything about the tubes.
Do you find that healthcare professionals and student healthcare professionals, do you think they should know more about the tubes? Do you find that their knowledge is good, or?
I mean, I would like them to know that if the tube that goes into my abdomen, if that comes out, I would like them to know that there's a certain amount of time for them to get another one back in.
Well, I would say probably in a medium-sized city, there's probably about 100 odd people living with a tube. So I think it would be quite helpful to have a standard of, what people at home with feeding tubes could expect of support.
No, that would be really useful, because when you talk to people on social media who have tubes, you realise how different the experience is for people in different parts of the country. There are things that my hospital deem essential for me, yet other people can't get those things because in their area they're not deemed essential. And to my mind, there should be a national standard. Yes, I think it's either essential or not.
I think one of the aspects we need to focus quite strongly on is trying to rectify the variation. It's good if there's actually something patients can connect to in terms of assistance and support, but we know they're not as good as they could be, and there's a huge variation around the country and different areas. Some people have got community services, others have absolutely nothing, and from our point of view as a patient support group, we get quite a lot of calls at weekends from people saying, I've got a blocked tube, or it's not working, or there's a problem, and there's nobody to turn to, or they've got a dead end phone number, or they're referred back to A&E, where yet again the people don't actually know how to manage the situation. So we really need to drive better services, more standardisation, and make it equitable for patients no matter where you live.
And from a BAPEN perspective, we've talked for many years around how nutrition support teams sit at the centre of that model of care. Nutrition support teams, like BAPEN, are multi-professional teams that provide the best care for patients, and it's understanding how we deliver that not only within organisations but outside of organisations across the kind of continuum of healthcare services 7 days a week.
Yeah, a nutrition support team is fundamental for the patient because you actually get the diverse knowledge, and you actually then have a team of people that you are familiar with, and if there's a problem you can go to one or the other. Sometimes we actually find people have only got one contact, and if that person's out the loop, then the whole support network falls apart. So we have frameworks in other areas of artificial nutrition. Maybe it's time that we need to be pushing for a stronger, more robust structure to support patients because the numbers are growing.
Yeah. So that's around having a national framework for enteral tube feeding. And coming back to the kind of point about what good looks like, not only at a local level but a national level, and that addresses the variation.
It's really easy to get dehydrated if you don't have your tube. It's really hard sometimes if your tube needs replacing and you have to wait sort of some period to get a new tube. It's really hard to maintain some sort of nutrition, some sort of hydration, and I think that medical professionals don't perhaps appreciate how hard that can be. Because when you first get a tube, it's kind of liberating in a way. I know some people would think it's just the worst thing ever, but as to me it was liberating because you no longer have to worry about what you can or can't eat, what may or may not make you ill. So you really come to rely on it. And when you don't have it, it's a problem. As soon as you go outside of that specialist cocoon, and people have no idea. And I've ended up in different hospitals where they have absolutely no idea, and I'm having to tell them what to do.
Okay.
So that's hard. Feeling that I have to stand up for myself and